Are you having trouble getting your uterine lining thick enough to have an IVF transfer? If you want some tips on how to improve that, keep watching. Hi, I'm Dr. Marc Sklar, the Fertility Expert, and welcome to Fertility TV. This is your YouTube channel dedicated to empowering your fertility. I've been helping couples from all over the world get pregnant for over 17 years with my virtual consultations and online fertility programs. If you're trying to get pregnant, subscribe and hit the bell so I can help you too. And one of the most important things for a successful IVF transfer is having a healthy, thick uterine lining. But that's not always possible for patients. I definitely have patients who have a hard time getting their uterine lining thick enough and healthy enough to move forward with a transfer. So I want to give you some tips on how to improve that. But before I do, I want to tell you what is appropriate, what we're looking for in a healthy endometrium. So first, a healthy endometrium should be a minimum of 8 millimeters thick, can be 9, 10, or 11, or 12, but at least 8. And we want it to have a trilaminar look. So it's got 3 layers in the endometrium, okay? That's really what a healthy endometrium should look like and what we're striving for. One of the things to also take into account if you're having trouble getting there is, what are you doing or taking that could be interfering with your lining and not helping it get there? One of the main culprits for it is Clomid. Clomid, yes, does stimulate ovarian function and follicular growth, but one of the main side effects for Clomid is causing a thin uterine lining or endometrium. So repeated use can definitely interfere with endometrial health. So we got to be careful of that. Have you had repeated use in the past? How long has it been? And how can we recover for that or from that? So 3 tips on how to recover and improve your endometrium. First and foremost is acupuncture. I'm going to say acupuncture. I'm also going to group that with acupuncture and herbs, because if you're seeing a good acupuncturist, hopefully they're also a good herbalist and they can prescribe some good herbs to help improve an endometrium, which is what I do for my patients. But acupuncture alone, specifically electroacupuncture, has some really great results for increasing endometrial health and improving blood circulation to the area. A lot of what we're trying to do here is improve blood circulation throughout the body, especially to the uterus. Number 2, one of my favorites, vaginal steam baths. This is something that's been done for centuries. It is something that's very beneficial for the uterine health and for cleaning out the uterus. I like to combine this with taking herbs internally, and I've seen wonderful results with patients doing it this way. I created a custom blend. I've got it right here. I'm trying not to trip over my wires. This is my custom blend for vaginal steam herbs that's going to help to improve your uterine health and increase more blood circulation to your uterus. And then last tip is abdominal massage. Again, we're talking about increasing circulation and blood flow through the pelvic region and into the uterus. Abdominal massage is excellent for that. So start working on your abdomen, and if you can't do it for yourself, then find someone locally who can definitely do that for you. So those are my 3 tips on how to recover and improve your endometrium. Most women need a little bit more support and appreciate being supported by a group of women going through the same thing that they are. IVF is no different, and it's even more important in IVF. To get your group support for IVF, then check out my IVF group support program. Click on this eye icon right here or click on the link below. And for more videos on IVF and everything related to fertility, check out my list of videos right here. Before you go, make sure to complete your fertility wheel. It's going to help you find out which of the 12 areas affecting your fertility is not letting you get pregnant and what to do about it. If you've been trying to get pregnant for over 6 months, it's time to take action. Click on the little eye icon to get the best free guides and resources to empower your fertility that I only share with my community. You'll get an email a week with all my new tips.